Do you think irregular periods aren't important? Think again. They might be your body's warning sign about something crucial to your health. I am Dr. Handan Namlı, an obstetric, gynecology, and fertility specialist. Over the past 20 years, I've helped more than 10,000 couples achieve their dream of parenthood. In this video, I'll clearly explain the hormonal and physical changes during menstrual cycle, why irregular cycles occur, how they affect your fertility, and when it's important to seek medical help. Watch until the end to fully understand your body. Your menstrual cycle begins on the first day of your period, day 0. At this point, estrogen and progesterone levels drop, and uterine lining endometrium sheds, causing menstrual bleeding. These hormone changes signal the brain to release gonadotropin-releasing hormone, which stimulates the pituitary gland to release follicle-stimulating hormone. FSH helps prepare follicles, small sacs containing eggs, in the ovaries. During the first 3-4 days, many follicles start developing. Around day 4-5, one dominant follicle emerges, producing estrogen. This estrogen signals the brain to adjust FSH levels and prepare for the release of luteinizing hormone, which triggers ovulation. At ovulation, the dominant follicle releases an egg. The fallopian tube catches the egg, which survives for about 24-48 hours. If sperm are present, fertilization can occur. The fertilized egg travels to the uterus, dividing and developing along the way. After about 5-6 days, it reaches the uterine cavity. After ovulation, the empty follicle turns into a corpus luteum, producing progesterone. Progesterone prepares the uterine lining to nourish a possible embryo. If the embryo implants successfully, it starts producing beta-HCG, the hormone detected by pregnancy test. Beta-HCG can be detected around 8 to 10 days after fertilization. If fertilization doesn't happen or implantation fails, the corpus luteum breaks down, progesterone and estrogen levels drop, and menstrual bleeding begins again. Why irregular periods matter? Irregular menstrual cycle can signal underlying issues. A normal menstrual cycle ranges between 21 and 35 days. Periods outside this range, heavy bleeding, bleeding between cycles, periods lasting over 7-8 days, or unusual light bleeding could indicate problems. Hormonal causes of irregular periods: polycystic ovarian syndrome, insulin-resistant, thyroid or prolactin hormone disorders, obesity or being underweight, imbalances in androgen hormones, male-type hormones, early menopause. Physical organic causes of irregular periods: ovarian cysts, endometriosis, endometrial polyps, uterine fibroids, cervical lesions, and pregnancy-related abnormalities, endometrial hyperplasia. This means thickening of the uterine lining. Irregular bleeding might indicate early pregnancy complications such as ectopic pregnancy, miscarriage, or biochemical pregnancy. What is biochemical pregnancy? A biochemical pregnancy is a very early pregnancy loss shortly after implantation. I've made a detailed video about this topic. Check the description box below for the link. What about ovulation bleeding? Some women experience very light bleeding during ovulation, which is usually normal. When to see a gynecologist? Visit your doctor if you experience persistent irregular cycles, heavy bleeding, or spotting between periods, difficulty conceiving. During your visit, your doctor will review your medical history, perform a physical pelvic exam, conduct a vaginal ultrasound, and other blood tests for hormones like FSH, LH, estrogen, progesterone, thyroid hormones, insulin, and sometimes prolactin. Impact on fertility. Regular cycles generally indicate regular ovulation, which is crucial for conception. Irregular cycles can make it difficult to pinpoint fertile days, complicating efforts to become pregnant. If you are trying to conceive, regulating your cycle is essential. Every woman is different, so treatments vary. Monitoring your symptoms and regularly consulting your gynecologist helps find the right approach. If you found this video helpful, please share it with your friends. Leave a comment about your experiences. Your story might inspire others. Don't forget to subscribe. I post valuable fertility and health videos every week. If you have topics you'd like me to cover, please let me know in the comments. Take your menstrual health seriously. Stay informed and stay healthy. See you in my next video.